Hello. Okay, so I've located another story for us today, and it's pertaining to antipsychotic drugs in nursing homes. So, and you do have to excuse the sound in the background. It's kind of hot, so I have the AC and everything running. But if you can hear me, um, so what I came across was an article, just pretty much showing here that long-term care, for those that know, that's people that reside in nursing homes, and usually that's for the elderly. But there's an article I found in the New York Times, and it says phony diagnosis hide high rates of drugging at nursing homes. And as we can see here, this was posted on the 11th of this month. But if we go here, this is an article dating back to 2016, and with the research, this has been like standard procedure since the 40s, and I'm pretty sure if we keep on looking, it's probably just been going on since the beginning of time. But basically, what's going on is that the nursing homes are short staffed, and because of that, they will give the patients heavy sedation medication by giving them a schizophrenia diagnosis, as we can see highlighted up here. So if you want to take the time and read these articles for yourself, the reason why I put this one in to the right is because this one is coming out of a pharmaceutical journal, so that means that you can bank on this information. It's telling you right here, antipsychotic use in care homes persists despite government drive. So it's against the law, but they still do it because there's nothing else that they can do, considering that, this means that they're short staffed, and it's always been a shortage of staff for nursing homes. So I know there's a lot going on in society, but information seems to help cure violence from time to time, I guess. And this is something to know, that people, caring for loved ones when they get old, they can end up in nursing homes. I also came across a video on YouTube. One was pertaining to the antipsychotic drugs. If anybody was wondering, like, what will it do to anyone, I found like a video. It's about 4 minutes long, from a simple nursing, and it's pretty good, explaining like what the antipsychotic drugs can do and why they're illegal. So I'll play this clip. It's about 4 minutes long.
Nursing.com. Check out our brand new app. Get access to our new pharmacology and med-surg mastery courses, plus a massive quiz bank loaded with detailed rationales to test your knowledge. Join for free. Click the link in our description below. Now, antipsychotics, the first generation typicals, are haloperidol. Now, the indication is for schizophrenia and Tourette's to control the motor movement. It may be given together with short-acting benzodiazepines like lorazepam to control aggressive behavior. Now, common side effects that are normal are the dystonic behavior found in extrapyramidal symptoms, or EPS. So dystonia, or basically spasms and muscle contractions of the neck and face and tongue, guys, these are not life-threatening, so there's no need to report to the HCP. Now, the big key point here and the killer adverse effect, write this down, NMS, Neuroleptic Malignant Syndrome. Now, guys, this is a huge life-threatening condition. Basically, it's a potential life-threatening reaction most often seen with typical antipsychotics like haloperidol. So think hal neuro for haloperidol and neuroleptic malignant syndrome. Now the key signs to look for, write these down: high fever and diaphoresis, or basically sweating, change in mental status, muscle rigidity, as well as tremors. Now the priority action here is to hold the haloperidol, assess the patient, and immediately notify the HCP. So do not wait 30 minutes, guys. Don't document. Notify the HCP immediately. Now the NCLEX will try and trick you, so don't get tricked. NMS is a complication of haloperidol and not of hydrochlorothiazide. Now thiazide and hydrochlorothiazide indicates that it's a diuretic. This was a very commonly chosen distractor on a lot of question banks. Now for second generation atypical antipsychotics, we have clozapine and risperidone. Now again, the indication is for schizophrenia and schizoaffective disorders, specifically in clients that have not responded to other antipsychotics. Now some common side effects which no need to report. We have weight gain, so we teach clients about weight management, and also hypersalivation, or basically drooling. And a big one here is sedation, but it usually improves with increased tolerance. Now the major side effects, guys, to write down: agranulocytosis, or basically low WBCs and low immunity, aka leukopenia and decreased neutrophils. So just think that we get increased infection. And the memory trick here is clozapine zaps those WBCs. So key points to write down here: sore throat, fever, and flu-like symptoms. Guys, the priority action, immediately report to the HCP. Now lastly, a big contraindication is patients with dementia. So we never give clozapine, which will actually increase mortality in dementia patients. So guys, a big HESI question was, which med order for dementia requires intervention by the nurse? And the answer was risperidone. So guys, remember, risperidone we remove from dementia with risperidone or risperidone. Now ziprasidone hydrochloride, brand name Geodon. The indication is for bipolar mania or acute psychosis with agitation. Now the major adverse effects are seizures, but cardiac issues are more common. So guys, big key point here: hypotension, and we monitor for widened QT intervals, which can lead to cardiac arrest and then death. So monitor the ECG and BP closely. And the memory trick here is ziprasidone or ziprasidone. So it's done prolonged your QT waves and done dropped your blood pressure. So that's how you remember it. Thanks for watching. For our full video and new quiz bank, click right up here to access your free trial. And please consider subscribing.
There's also another video. This is just a 28-second video. I won't play it. But if you want to, you can look at this one. It's just another affirmation, and it's 3 years old, about nursing homes using antipsychotic drugs for overstaffing reasons. And then also just one other one, kind of showing you, because some people feel like, well, if it's not okay over here, I can just go overseas somewhere and it'll be better. But it's the same thing going on over there overseas. So the only takeaway was, it was a little while ago, there was an article about a man that was arrested and then put on the psychiatric ward and given psychotic medication. I don't know if I can be able to. Yeah, this article right here in the Washington Post. There was a man, he was jailed for 2 years and claimed to have been delusional. This story was just last month, but you can come across this article Washington Post and read it yourself if you don't believe me. There's a man that was jailed for it was a mistaken identity and put on the psychiatric ward and given psychiatric medication, and he wasn't supposed to have been. Wasn't anything wrong with him, and what do you know? It happens. So that's another good read for you if you like. Alright, so that's it for today. I just kind of wanted to, push another video out there to let people know that I know no one really wants to look at the news. I know I get tired of it sometimes and it is very depressing, but I think just kind of talking about it helps to get over the anxiety and kind of, everybody, we all feel the same, so let's get through this together. We can get through this together. So let's just keep everybody in our prayers. And so I'm still working on the Taliban comparison to Chicago violence. And I want to put out another 1 or 2 more videos before that one, because I might try to make the Taliban one Chicago kind of longer and kind of really open it up and get that dialogue started. Maybe it'll help. 1 or 2 people is better than just burying your talents in so many words. But thank you so much for watching. Please like, subscribe, share, comment, share this to your family. And until next time, family, stay blessed.